Good afternoon, colleagues. Good afternoon, Nebraskans. I think that it is because of divisive abortion bills that we have heard really in the past 4 years, starting with Senator Albright's ridiculous abortion reversal bill that is not based on any fact or science, and then Senator Geis' method ban bill, which banned a safe and effective and, what physicians think is the best method of abortion for many patients. All of these bills had to come to this floor through poll motions. And Senator Albright cited how many times in the history of this institution floor motions have been used, how many times they've been successful. And she said that history showed how rare this motion is and how difficult it is for this motion to be successful. But colleagues, just in the last 4 years, we've seen this motion used time and time and time again to subvert the committee process, to move radical anti-woman, anti-family, anti-choice bills through this legislature in a way that the majority of Nebraskans just don't agree with. And not only that, it derails the important work that we're trying to do on the floor on other issues. I was saying last night, we have less than 100 hours left of debate now in this body until we're done with this session. We got a canal y'all want to have, we have a lake you want, we've got to regulate these casinos that are coming through, we've got the gun bill, we have your tax cuts that you want so bad. All of these things are going to be in peril because you're giving the time up for that in order to have an abortion bill. Please understand, and you do, that this bill is going to go the distance. We're going to take every minute possible on this bill and make it as difficult as possible to pass in a state where I know the majority of the people in this legislative body are supportive of taking away that right to choose, are supportive of hurting women in these families who need this health care, who think that they as politicians know what's best for families and Nebraskans instead of the women themselves and the physicians who treat them. Farmers, bankers, teachers, career politicians, nonprofit workers. None of us are qualified to stand between a patient, a pregnant person, and then what they decide with their family, their faith, and their physician is best for them and their families. This is a waste of time, and this is exactly what Nebraskans are not asking us to do. The introducer of the bill, who I have great respect for, noted that she has respect for this process. And that's correct. There is a process by which you can pull a bill out of committee, but we have a committee process in this body for a reason. The reason we have a committee process in this body is so that the people on those committees can become subject matter experts in the area that they serve on those committees, in those jurisdictions. And that's why members of the Judiciary Committee sit in committee often until 11 p.m. or midnight in a way that no other members of this body typically has to do, because they have the subject matter jurisdiction, and respecting that committee process is important. Now, I respect that there is a rule that Senator Albright is availing herself of today, but I think that that disrespects the committee process, and for that reason and many other reasons, I will be voting against this. It was Senator Albright's prerogative to prioritize this bill. Well, I guess she didn't. It's Speaker Hilger's prerogative to prioritize this bill before it came out of committee, and the committee decided it was not ready to come to the floor. The bill doesn't have a committee statement. I don't know what people on the committee thought of it. I don't know who testified and this and that. It doesn't have a committee amendment. And for that reason, it's going to end up being the most oppressive abortion bill that we can see in the United States, because practically, in practical terms, and I'll talk more about that, we're not going to have any exceptions for the life of the mother. This affirmative defense thing that they're saying to cover themselves from accusations of being unconstitutional, which I believe this is unconstitutional. We have this affirmative defense saying that, well, if there's a case of the life of the mother, then the physician's not going to be prosecuted. But that's not decided until they go to court. The chilling effect that this is going to have on health care, especially in rural Nebraska, is something that all of you are going to come to extremely regret. Thank you, Mr. President.